Hello, ladies. You've come to the right place at the right time. The place is Menopause University. The time is in time to learn more about epithelial ovarian cancer. This unit on epithelial ovarian cancer began with video number 413. And this is the 22nd video in the unit. I started by teaching you the anatomy of your reproductive tract in general and your ovaries in particular. And then I segued into the different kinds of ovarian cancer. You learned that the cancer of concern for purposes of your menopause is epithelial ovarian cancer. And the specific kind of epithelial ovarian cancer of concern is serous epithelial ovarian cancer. Then I gave you 13 videos on the risk factors for epithelial ovarian cancer. So now you know all the things that can increase your risk of epithelial ovarian cancer. Now that you know that, you need to know how to recognize it early should you ever get it. So you are in the right place at the right time, and that's because we'll discuss the symptoms of epithelial ovarian cancer in this video tutorial. And if you don't know the symptoms, you could find yourself in a situation of knowing too little, too late. You know that all of chapter 32 in my book, both the first and the second edition, is on epithelial ovarian cancer. So there you'll find an abbreviated version of what I present here. All right. What do you already know about the symptoms of epithelial ovarian cancer? I can't hear you. You're too quiet. I think this is the right place and the right time for a quiz question. How would you answer this one? Which of the following is true regarding the symptoms of epithelial ovarian cancer? A. It is a silent disease with no symptoms. B. The only symptoms are gastrointestinal or GI symptoms. C. The only symptoms are genitourinary or GU symptoms. D. It is a disease with definite but non-specific symptoms. E. Most women have gastrointestinal and genitourinary symptoms rather than gynecologic symptoms. F. Most women have symptoms for several months before diagnosis. G. Most women have symptoms that occur on a daily basis. H. Most women have increasing severity of symptoms over time. I. D, E, F, G, and H above. J, B, F, and H above. K, C, and G above. Well, how did you do? Did you have the right information you needed in the right place at the right time for answering it? Or did you feel like you knew too little, too late? Well, without further ado, I will show you the quiz question again with the answer in bold. So the correct options were D. It is a disease with definite but non-specific symptoms. E. Most women have gastrointestinal and genitourinary symptoms rather than gynecologic symptoms. F. Most women have symptoms for several months before diagnosis. G. Most women have symptoms that occur on a daily basis. And H. Most women have increasing severity of symptoms over time. Okie dokie. Let's delve into the things you need to know in order to recognize the symptoms of epithelial ovarian cancer. I will divide them into 3 categories of characteristics. Category 1 is the you snooze, you lose category. Category 2 is the wrong wrong place at the wrong time category. Category number 3 is the too little, too late category. You know, when I'm creating these videos, I commonly burst out laughing. I hope you realize that you will never find anything whatsoever anywhere in medicine that presents things the way I do. I make all of this stuff up, and the reason I make it up is to ensure your understanding. The actual facts are all the same as anything you would find in a medical textbook, but you wouldn't understand any of it in a typical medical textbook in typical medical lingo. So I just think of ways to present it in order to ensure your full understanding. So don't go looking for anything pertaining to you snooze, you lose, wrong place at the wrong time, or too little too late. You won't find these categories anywhere but here. So let's go through them one by one so that you never forget the symptoms of epithelial ovarian cancer. We'll start with the you snooze, you lose category of characteristics. Now, historically, doctors thought that epithelial ovarian cancer was a silent disease. As you've seen in previous units on other diseases, there are actually a lot of silent diseases. Heart attack is silent until the final critical event. Osteoporosis is silent until you fracture your hip or spine in the absence of any trauma whatsoever. Alzheimer's is silent until half of your brain is gone. Breast cancer is silent until stage 3. And until recently, doctors thought that epithelial ovarian cancer was silent too, but that is not the case. It turns out that rather than being silent, epithelial ovarian cancer is merely quiet. Symptoms are there, but they're too quiet to get your attention. Unlike the squeaky wheel that gets the grease, these symptoms follow the you snooze, you lose path. So the you snooze, you lose characteristic means that the symptoms are vague and non-specific. They are symptoms that most women have from time to time. So women do not suspect them as constituting a serious disease, and neither do doctors. But by learning about them here at Menopause University, you'll recognize them as the quiet, vague, non-specific symptoms of epithelial ovarian cancer. And hopefully that will induce you to be a squeaky wheel and complain more persistently about them. Doing so will require your doctor to listen more carefully. So you won't snooze and you won't lose. So the very first characteristic of the symptoms of epithelial ovarian cancer is that they are so quiet, vague, and nonspecific that if you snooze, you lose. You lose the opportunity for an early diagnosis, that is. You saw this same phenomenon with heart attack. It's not that there are no symptoms of heart attack in women. It's just that the symptoms of a heart attack in women are different from those in men. Men have heavy chest pain with radiation down their left arm. Women have jaw, neck, or back discomfort that they do not describe as pain. If you ignore these symptoms, you miss the diagnosis. You snooze, you lose. The goal is to avoid the pitfall of you snooze, you lose by being aware of the quiet, vague, non-specific symptoms for epithelial ovarian cancer. The second characteristic of the symptoms of epithelial ovarian cancer is the wrong place at the wrong time category. Now, obviously, this category actually encompasses two separate things, place and time. I will address them separately, starting with wrong place. The wrong place is precisely what it says. The symptoms of epithelial ovarian cancer are in the wrong place. This is because of the fact that your ovaries are part of your reproductive tract. As part of your reproductive tract, you would expect cancer of your ovaries to produce symptoms that you associate with your reproductive tract. You would expect to have something along the lines of menstrual-like cramps, sharp pain in the region of your ovaries, vaginal bleeding, pelvic pressure, or pain during intercourse. These are all gynecologic or GYN symptoms, but none of those is a symptom of epithelial ovarian cancer. The big problem with the symptoms of epithelial ovarian cancer is that they are all gastrointestinal or genitourinary symptoms. In medicine, we use the abbreviation GI for gastrointestinal, and we use the abbreviation GU for genitourinary. So the symptoms are all GI or GU rather than GYN, and that's confusing. The most common GI symptoms of epithelial ovarian cancer are abdominal bloating and increasing abdominal girth. Who doesn't have those things, especially with menopause? Most women occasionally complain of abdominal bloating. Oftentimes, it's associated with eating a certain kind of food. Other times, it's attributed to hormonal changes. But in these instances, it's typically intermittent rather than persistent. Regardless, very few women would associate abdominal bloating with cancer. So abdominal bloating as a symptom of epithelial ovarian cancer seems like a symptom in the wrong place at the wrong time. More specifically, it's in the wrong place. The other most common GI symptom of epithelial ovarian cancer is increasing abdominal girth. The difference between abdominal bloating and increasing abdominal girth is that bloating is intermittent while increasing girth is persistent. The problem with recognizing this as a symptom of cancer is that menopause itself results in the slowing of your metabolism, and that creates weight gain in your abdominal region, which manifests as increasing abdominal girth. Very few women would attribute increasing abdominal girth to epithelial ovarian cancer, especially when they see abdominal girth increasing for all the other menopausal women too. So both of the GI symptoms of epithelial ovarian cancer seem like common, typical experiences for the vast majority of menopausal women. Well, what about the genitourinary or GU symptoms? The most common GU symptom of epithelial ovarian cancer is urinary urgency. Urinary urgency is a sudden, compelling urge to urinate that makes you rush to the bathroom. Once again, what menopausal woman doesn't have that? Most menopausal women ask where the bathroom is upon first entering any building. And that's because urinary urgency is a typical, common, everyday occurrence in your menopausal years. You get the urge, you rush to the toilet, you urinate, and that's that. This daily event does not make you think you have cancer. So these three symptoms constitute the triad of symptoms that is most common for epithelial ovarian cancer: abdominal bloating, increasing abdominal girth, and urinary urgency. It's a triad of GI and GU symptoms rather than GYN symptoms. No other symptoms are as common as these three. So you can understand why most women and doctors fail to recognize them as symptoms of epithelial ovarian cancer. Now, the other part of this second category is wrong time. It's the wrong time. All three of the symptoms that constitute the triad of symptoms for epithelial ovarian cancer occur on a daily basis. Anytime something occurs daily, we come to assume it's normal. Even if it's new, it seems like the new normal. If, as a menopausal woman, you start noticing abdominal bloating after meals, you assume it's your new normal. If, as a menopausal woman, you start experiencing increasing abdominal girth like every other menopausal woman you know, you assume it's your new normal. If, as a menopausal woman, you start having urinary urgency like most menopausal women, you assume it's your new normal. So the pace of all three is so regular and predictable that they don't make you think of cancer. So together, they all constitute symptoms that are in the wrong place at the wrong time. So you can see why I chose to use this wrong place, wrong time tagline for the symptoms of epithelial ovarian cancer. But there's more. The third characteristic for the symptoms of epithelial ovarian cancer is too little, too late. This refers to when these symptoms occur in the course of the disease process. When it comes to cancers, early diagnosis is always the key to success. If the symptoms occur early in the course of the disease, they enable you to diagnose the cancer at an early stage. No matter what kind of cancer it is, the earlier the diagnosis, the better the outcome. On the contrary, the later the diagnosis, the worse the outcome. Well, with epithelial ovarian cancer, the triad of GI and GU symptoms is too little, too late. The symptoms usually begin just 4 months before the diagnosis of epithelial ovarian cancer. And then they occur on a daily basis during that 4-month period of time. All the while, they slowly increase in severity. But that increase in severity is so gradual that you tend to just think of it as part of getting older. You assume that more bloating with time is normal, and that increasing abdominal girth is normal, and that more urinary urgency is normal. And by the time this triad of symptoms is severe enough for you to seek medical attention, the cancer is advanced in terms of staging. As a result, based on symptoms alone, most epithelial ovarian cancers are diagnosed late. So now you see why I chose our 3 taglines for this tutorial. You snooze, you lose reflects the quiet, vague, non-specific nature of the symptoms. Wrong place, wrong time reflects the fact that the symptoms are common, daily GI and GU symptoms rather than GYN symptoms. And too little, too late reflects the late stage of diagnosis when the symptoms gradually become severe enough to send you to the doctor. Now, obviously, no 2 women are alike, so it is possible to have other symptoms that accompany epithelial ovarian cancer. But the ones I've delineated thus far are the classic hallmark symptoms. Other symptoms tend to be outliers. The other outlier symptoms include abdominal pain, feeling full, difficulty eating, urinary incontinence, and urinary frequency. But notice that these 2 are all GI and GU symptoms rather than GYN symptoms. The key is to know that the symptoms do not make you think of your ovaries. Now, you know how big I am on making sure everything makes perfect sense. So based on what you've learned thus far in this unit on epithelial ovarian cancer, can you think of any reason that might explain why The symptoms of epithelial ovarian cancer are mostly GI and GU. Reflect back on what you learned about the anatomy of your ovaries in video number 416. This outer layer, this outer epithelial layer that's like saran wrap, extends beyond your ovaries and covers all the organs in your abdomen and pelvis. So when epithelial ovarian cancer begins in this epithelial layer that covers your ovaries, it's really not just your ovaries that are affected. Instead of being limited to epithelial cancer of your ovaries, it's really epithelial cancer of all your abdominal and pelvic organs. It's like this, all over your pelvis, and your gastrointestinal tract is covered in it too. So what you end up with, this thing's heavy, is this. Makes sense, doesn't it? I mean, I know it looks horrible, but it makes sense. It gives you the logic you need to understand why the symptoms are GI and GU in nature, because this layer covers all of it. So here's the summary for today, categorizing the material by our 3 taglines. When it comes to the symptoms of epithelial ovarian cancer, you snooze, you lose means that the symptoms are so quiet, vague, and nonspecific that women do not expect them to constitute the symptoms associated with cancer. Wrong place at the wrong time means that the classic triad of abdominal bloating, increasing abdominal girth, and urinary urgency are all GI and GU rather than GYN symptoms that most women experience at menopause. And too little, too late means that these symptoms occur late in the disease process, when the cancer is already advanced, resulting in a late diagnosis at a late stage. Here's a chart reflecting all of this. I mean, I know how much you all like my charts. Across the top row, you see our triad of symptoms for epithelial ovarian cancer. Abdominal bloating, increasing abdominal girth, and urinary urgency. Along the first column, you see our 3 taglines for their category of characteristics. And in the cells, you see the basic details of each. Now you can access this chart at menopausetailor.me, where you'll find all my charts. Alternatively, you can access it via the link in the description box just below this screen. Well, whenever you can't rely on symptoms to alert you to a cancer early on, what do you use? A screening test. So that's what we'll discuss next week. You are in the right place at the right time to subscribe to this channel and my newsletter. It's never too late to go to menopausetailor.me to schedule a consultation. And you snooze and lose if you don't follow me on Facebook, Instagram, Twitter, and TikTok. All social media and my newsletters inform you of specials, promotions, new events, giveaways, and such, all kinds of things. I stay so far ahead in creating these videos that you might miss something if the videos are all you use for your menopause education. I love seeing you any place, at any time. Bye.